Hill. Well, it's American Heart Month, and today our Heart of the Valley focus is heart health. For more than a week, we've been sharing important facts about heart disease. Like every 33 seconds, a person dies in the U.S. because of a heart-related illness. Joining us this noon hour to talk about what we can do to reduce our risk is Dr. Federico Aspurua, cardiologist with South Texas Health System. Thank you so much for joining us today.
Thank you very much for the invitation. Glad to be here.
We have so much to cover, so let's get straight to it. Heart disease. It is the #1 killer in the U.S. for men and women, not cancer, right?
That is correct. That is correct.
So what are the warning signs, and are they different for men and women?
Well, they can be different. Yeah, they can be different for men and women, and they can be different for, everybody's very, very peculiar. But the most important symptoms to look for, or signs, are basically exertional. When patients develop chest pain or chest discomfort or shortness of breath, they get tired when they're doing physical activities, and it gets better with rest. When they sit down or slow down, then their symptoms kind of resolve or improve. Those are red flags, things that we need to look for, and patients definitely need to look for help when they're having these symptoms.
Okay, so you're talking about shortness of breath, tightness in the chest.
Mm-hmm.
Some people may say, well, I've got heartburn or indigestion.
Yeah. Yes, so sometimes it's very difficult to differentiate one from the other, okay? And that's when, we have to listen to our bodies. If there is something happening that it's new, that we don't recognize, we must ask, okay? Because with heart, time is muscle, we say. The more we wait, the more damage there is to the muscle of the heart, which sometimes we cannot recover.
So what do you recommend to someone who is experiencing some of these symptoms? What should they do right away?
Well, if their symptoms are severe enough that they need to go to the emergency department, that's the first thing they should do. Call 911 or go directly to the emergency department, depending on how they're feeling. If these are symptoms that are more repetitive, that they've been happening already for a while, and they probably could see their primary doctors or they could see their cardiologist, definitely they need to seek for a medical assistance in a timely fashion.
And what do you recommend that we can do to reduce our risk? And what role do exercise and diet play in that?
That is very important, because cardiovascular disease are in a big part preventable, okay? And the main cause of cardiovascular disease are our lifestyles, okay? Diet, poor diets, high carbohydrate intakes, okay? The sugars, the flours, the starch, processed foods, fried foods.
Yes, we all love our burgers, our tacos.
Exactly. Here, the amount of carbohydrates that people eat is very important. So their diets are rich in carbohydrates, and that creates a lot of problems: overweight, obesity. They start developing insulin resistance, which is basically pre-diabetes, which will advance to diabetes as well. Elevated cholesterol, diet, and is also associated with high blood pressure. The lack of exercise is very important as well, and it's a risk factor. So things that we can do is having healthy dietary habits, okay? Eating healthy, for all our lives since we started as a young kids. I think that's something that parents have to do.
Teach them healthy eating habits at an early age.
Eating habits, correct. Yes, I don't like to talk or recommend to my patients that they need to do a diet, because then they see these, okay, I'll do it for a month or 6 months or a year, and then they stop. That's not it. We have to develop healthy dietary habits. It has to be a habit that
It's a lifestyle change.
It is a lifestyle, correct. And the same thing with exercise. We have to be active. We have to exercise at least 20, 30 minutes. Even a little bit is better than nothing.
Yeah, even if you just walk, it makes a huge difference.
It makes a huge difference, correct. Yeah, we have to be active. It's very important. It's very important to prevent this disease.
And so what are some of the treatment options out there? We always hear about medication, but what else is out there?
Well, it all depends on what stage of the disease the patients are at, okay? The most important treatment is prevention, okay? That's the most important thing. Prevent, lifestyle, not smoking, okay? Exercising, avoiding excess of alcohol, recreational drug use, management of stress, anxiety, sleeping well, resting. All these things are very important. Treatment-wise, of course, there's medications that we need to treat the risk factors, like treating blood pressure, high blood pressure, treating diabetes, treating cholesterol, and there's always in certain patients the role for aspirins or medications similar to aspirin. And if they're in a more advanced stage where there's already narrowing of the arteries of the heart, then we could do what it's called revascularization, where we open the arteries. We could use via catheter, which is a small device that goes into the heart. With a balloon and a stent, we open and restore the blood flow. Some patients, unfortunately, have more advanced disease or more complex, and they need bypass surgery, which is basically open heart surgery.
All right, well, we have to wrap this up, but real quick, what's the one message you want everybody to take home today?
Lifestyle. We have to start early with lifestyle. Healthy eating, exercising, avoiding smoking, avoiding excess alcohol. But lifestyle is extremely important because this is preventable.
All right, well, we thank you so much for joining us and sharing that important information.